So when they have this uncertainty or unsurety, you know, they are going to stay on the fence. You know, now in the past, when Mr. Cornwall has produced his bill, twice it didn't make it to the second reading, you know, and twice it didn't get proper hearing, and twice, you know, so I think that was the safe bet for the Premier to do. Now, I did not support the George Smitherman's panel on their findings that Ontarians were not in favor of it because it was based on very flimsy research. You know, there was only 2,000 people that responded to their 4 months, $2 million panel, and most of these people responded through the internet. Most of them were paid. You know, did the public know that? I mean, the public did find out about that. So how can you base such an important decision based on such flimsy evidence?
And based on this, are you promoting, or did you already promote, or you want to promote another online petition from people, maybe sending email to their MPPs or the premier of provinces to push for this new law on organ donations? Are you going to promote something like this too?
Since day one, since 1997, that's all I've been doing, is promoting that I've been saying that we can solve this shortage, but we can't just look at one part to solve it. The bill is an important part, you know, the system. It would tackle the shortcoming, but we also need to do other things. We need more retrieval centers in Ontario. There's remote areas where people are willing to donate their organs, but it's going to be impossible for their organs to get used because there's no retrieval centers to harvest them properly so that they can get to people. And people up north know that very well. I've been up there so many times, and yeah, and you know, and this is for other parts of Canada as well. So retrieval centers. Also, we still don't have enough heart dead donation surgeries going on. And that only came into play a couple of years ago, and we were urging that for the past 7 years. You know, there's many other things, and it's also going to be our attitude and perception towards this issue. That's why Spain has been so successful, is because they have a certain attitude and perception about this issue. They feel that, you know, they had a 96% success rate in finding organs for the people on their waiting list, and yet they want to shoot for 100. So they have that desire and that attitude to do it, and that's what is really needed here in this province.
Percentage.
Yeah, exactly. We have to understand that it doesn't cost anything to be an organ donor. You know, people aren't asked for money or to, and of course, if we're going to have more organ donations, we're going to need more facilities, more surgeons, more, you know. But I also want to point out, when I went to Spain, I did a very comprehensive study on the financial aspects, you know. And the bottom line was that the more organ transplants that Spain produced, the better off the healthcare economy is. Because if we look at our healthcare economy now, there's a lot of money that very sick people are dependent on, and that are candidates for organ donation. So if they receive their organ, then they get a healthy life, and they get back to work, and they start paying taxes. So it's almost like reforming welfare. And so, you know, the more transplants, the more surgeons you're going to have, the more investment. It's a great investment to make, not only for the sake of saving lives, but you're going to get a big financial return on this. And that's the other part that I've been urging the government to look at as well, because usually these things do come down to what's the price, you know. The price is that any government, whether it's provincial or federal, will end up saving the healthcare dollar, much dollars in the healthcare system, and get people back to work.
Beautiful, George. We do one-on-one if you can.
Sure,
okay
sure.
For you. Thank you, George.
Thanks, Joe.